Adjust the neck first seated, more for upper cervical. Headaches, as you know, eye pressure, eye blurriness, everything. And deep breath in, all the way out. There you go, doc. Easy. You do seated cervicals?
I don't, no.
I do because I have good malpractice. I'm good, I'm covered. Doesn't matter to me.
I shouldn't say I don't often, but
Yeah. I like them for the upper part, right there. Look at your shoulders then.
Sure.
Good. Right hand to your right ear. Deep breath in. Elbow in, all the way in. Good, all the way out. There you go, other side too. Deep breath in, all the way out, elbow in. Boom, good. On your back, my friend. And on your side for me too, this way. Yep. Get the leg drop for me. There we go. Right here. Ooh. How's your stretching, doc?
Not great.
All right, deep breath in, all the way out. There we go, other side for me too. Gotta move bones, docs. You guys know that, right? Leg drop. Right here too. There we go. And what I do, I modify, I should on the table too. I always put my, actually bring your leg back for a second. I always put my knee on the table, like this when I adjust somebody. Because by doing that, what does that do? When you're leaning over someone's back, right? Here. By doing that, younger docs, don't worry about it yet. When you get older, you'll figure it out. Is by doing that, the pressure's off your back. If I'm here adjusting this way, that's a lot of back pressure. That may be okay for like your first patient day. When you're on like number 70, it's not going to feel great. And even patients that I have that have helping their elderly parents at home, for example, I want to make sure they're helping them lift properly too by supporting their self first and then helping their family member up. Right? So here, let your leg drop. Good, deep breath in. All the way out. Easy, good. On your back for me too, that was a lot.